My first indication that this is the way I wanted my career to go started when I was about 16. I had some heart issues of my own, some electrical issues. I was implanted with an SICD, it's a Boston Scientific defibrillator. So that's really what first piqued my interest. And then my brother, shortly after, actually became a CRM clinical specialist. So he now works with devices, and gave me a very clear vision as to what my career might look like if I were to take a similar path. So I was a communications major at the University of Washington and heard about this program my third year. I graduated in 3 years, and knew I wanted to do a program similar to this, but right as I was graduating, this program all came together, and I was actually the first one to sign the program. And from there, really, at the time, many of my decisions were based off of personal reviews of the program that I had heard from individuals who knew many of our trainers. Obviously, the big asset of being attached to UT was really important to me, and having the significance of such a major university and medical program behind our program, with the physician exposure on top of that, was very important. The thing that sets this program apart from similar programs to it is the ablation mapping EP portion of it. So not only does this program tackle the whole world of devices, which is a difficult world to understand in and of itself, but it also adds in this mapping component, which then gives us as trainees and potential job candidates a whole nother avenue that we can go down in terms of looking for jobs. So right now we're in the last month of our program. We're every day in clinicals over at Memorial Hermann predominantly. We get a good view of a lot of device implants and then mapping procedures as well. And then in between those, programming of patient devices. I just signed with Boston Scientific in the Boston area to be a arrhythmia mapping specialist. My device that I was implanted with back when I was 18 is a Boston Scientific device. So there's a bit of personal history there. I would definitely recommend the program and the industry, physician exposure, having a really close relationship with a lot of the physicians that we work with is a special experience and one that I really value.